Welcome to BizTech's Health and Wellness Show featuring AGT Genomics. Now, our guest today is Dr. Chee-Onn Leong. He's the CEO of AGTC Genomics. Now, the focus of the interview is understanding the benefits of genome sequencing and why Malaysia can be the next genome sequencing genomic hub in Southeast Asia. Now, Dr. Chee, welcome to the show.
Thank you, Brian, and thank you for having me here.
Now, Dr. Chee, could you start by giving us an overview of AGTC Genomics and what it was set up to do?
Right. AGTC Genomics was actually incorporated back in, I think, August last year. We are relatively new. So we are basically a technology platform startup. Our focus are mainly on DNA sequencing and also offering genomic solutions to customer, including, for example, healthcare, as well as research university institute, as well as for the government as well. So that is our main focus. Of course, for us, we are, as a tech startup, we are also aggressively developing our own in-house technology. So the main idea is basically to make precision medicine and also genomic sequencing much more affordable to this part of the region.
Okay, Dr. Chee, I want you to take a step back and really break it down for us in really simple terms. Okay. What is genome sequencing and what are the key benefits to an individual?
Right. In short, I think genome sequencing, I think if you look at it, all the living organisms on Earth have DNA, right? So now the genome sequencing is basically a technology that helps us to sequence all the DNA, the sequence of it. And knowing the sequence is very powerful. The data that you can actually derive the value from is very powerful. For example, with the genome sequencing of the human, then we can actually identify what are the rare diseases, which was previously couldn't be identified. And also with the genomic data that we have, we can even predict certain risks for certain individuals, whether they would develop heart disease or even cancers, for example. I think it's a very powerful technology platform.
Okay, so that's very, very important because obviously, if you can do early detection with a lot of medical cases, early detection can also mean then you can intervene. Early intervention also means easier to cure. I mean, to break it down in very simple terms. Now, give us an example of how you have helped patients in terms of this and some of the outcomes.
Right. Now, like, for example, okay, in our lab, basically, we have done some sequencing for some rare diseases. So these are children that are born with certain symptom or certain illness, which currently the clinics actually do not have a solution and they do not know what it is. They have exhausted all the diagnostic avenue to try to find out what it is, but they couldn't do it. So what we are doing here is basically we try to do a whole genome sequencing. Basically, we sequence the 100% of the genome of this particular individual together with their parents as well, to really identify what are the mutations that are actually happening in these rare diseases. And from there, we will then try to see whether we can implement some kind of treatment or intervention to actually help the patients. So this is one area of it in terms of rare diseases. A more common one would be in oncology, for example.
Okay.
Right. So as we know, I think cancer treatment now is becoming very, very specific. There's something what we call a targeted therapy. So the drugs mainly focus on certain mutations in the tumors.
Okay.
Right. So, and with the whole genome sequencing and also the sequencing technology, what we can do is that we can actually profile the tumors, and then we can actually identify what are the mutations is actually inside these tumor cells. And then from there, we can then recommend the best treatment options to the patient without doing the try and error like what we have been doing all this while.
And Dr. Chee, obviously, that's a game changer because essentially, like you said, in the past, a lot of time is mode of treatment could be, oh, okay, radiation and chemotherapy, which
Yes.
is the baseline, which is tremendously detrimental to the physical well-being of the patient itself. But but that's a cost of treatment. Here with your technology, as you've pointed out, it can be far more focused, and therefore with the targeted therapies, more likely that you would have a higher probability of success.
Yes, precisely. I think this, what we are targeting is basically something what we call precision medicine. So we are trying to basically treat the patient, treat the right patient at the right time with the right drugs and also the right dosage. So that is what we are trying to achieve. So especially for cancer patients, basically is that every single minute, every single second count. So if we spend a lot of time on the diagnosis and spend a lot of time, try and error, the cancer, the tumor cells will actually continue to evolve. So that's why we want to hit it with the best possible and with the right drug possible. Yeah.
So Dr. Chee, then who do you work with in terms of your business? Do you work with the hospitals directly, or do patients come to you directly? How does that work currently?
Yes, currently, we are basically working in partnership with some of the hospitals here, major hospital here in Malaysia.
Okay.
So, of course, in the long run, what we are hoping to do is that we will try to set up our own pathology lab to actually cater this to the patients and also to the doctor directly.
Give us a sense then in a Malaysian context, how the response has been from the hospitals itself, because obviously this is relatively new in this market.
Yes, I think I would say is that currently the response is very encouraging. So I think it is actually better than what we expected. I think the COVID do give a lot of awareness in terms of this type of technology. Like when every time, the news come out about sequencing of COVID, I think the public know about it. So we even receive feedback from the oncologists is that actually patients are actually asking this kind of questions to the oncologists, which never happened, 2 years back, basically. The landscape is very encouraging. And what is more important is that I think for us, we are the first one in Malaysia who set up these facilities and with the capability to do a large scale sequencing. And what we offer here is basically, like previously, a lot of these hospitals, basically they outsource it to other countries. So the cost becoming very, very high. But now for the first time that we can actually do it in Malaysia, I think we can cut down the cost quite substantially. And that is one of the reasons that we want to bring the technology in here. So all I can say is, yes, the demand and also the interest is actually very encouraging. And I think, and I think that that will be a really, really great outcome and also the progress in this field.
Dr. Chee, especially as you pointed out with the COVID-19 response, governments overseas use genomic data to guide them from public health perspective in decision making. Yeah. How have you engaged the Malaysian government in this respect and Ministry of Health?
Yeah, interesting. So yes, we are actually working some of the projects together with some of the Malaysia government research institute, with Ministry of Health research institutes such as NIH, IMR as well. I think in terms of COVID, we are also working together with the Malaysia Genome and Vaccine Institute. So we are in a way contributing to the sequencing of the COVID as well currently. But of course, in the longer run, what we try to do is basically to establish a public-private partnership. So in the way is that, well, as a private company, we can invest in the technology so that the government don't actually have to spend the money to build these facilities. But at the same time, in return, so we will provide the service to the government. So in a much lower and also affordable price, basically. I think as the technology is developing, so quick decision need to be made. I think this is where we come in as a private, basically, is that, well, we can actually address the needs of the country in terms of the genomic sequencing capacity and also the capabilities. if you look at the numbers, basically, probably currently we are probably one of the biggest genomic sequencing capacities lab in the country.
Now, how does Malaysia compare to your peers in the region? So your peers in the region, Singapore, Thailand, Vietnam, they've started up their own national genome project. Where is Malaysia at?
But that is a very good question. So, I mean, personally, yes, you're right. I think most of the country, especially Singapore, they already have the Human Genome Project in Singapore. In fact, they have recently just announced the 100,000 Singapore Genome Project, so which is very exciting. For other countries, yes, as you mentioned, Vietnam, Thailand also have their own genome project. I think for Malaysia, we do have some of the studies that have done with the Malaysian genome, but then again, it's in a small scale. What we are really trying to bring to the market and also bring to the field is that we hope that we can work together with the government and also research university to really leapfrog the genomics technology in Malaysia and set up our own human genome, the Malaysian Human Genome Project.
Okay,
right?
so, but Dr. Chee, there's a big problem around that because, as you said, you're the pioneer, you're the first to market in a Malaysian context. But isn't talent and expertise a very big component of executing this? Where does Malaysia fare relative to your peers in the region? Because people like countries like Singapore have a far larger pool of talent to draw from.
Yes, this is indeed a very challenge. Well, this is indeed very challenge because to run this technology, yes, we definitely need talents. We definitely need scientists to run it. I think for us, we are fortunate enough. Okay, we managed to recruit our scientists from Singapore. Even some are from with Malaysian. Some are Malaysian with working experience in Taiwan, in US, in China as well. So this is currently the makeup of our scientist team at AGTC. Well, you're right. I mean, talents is going to be important if we want to push Malaysia back into the genomic race. And this is also one of the mission of the company, why we want to set it up here. We are also working closely with university to provide training to the scientists and even provide training for the government officer to actually master this type of technology. So if we want to move forward, obviously, we alone is not going to be enough. I think what we want to do is really collaborate, partner, and also join forces with all the other university and research institute to move this agenda together. Yeah.
Now, one of the key things, Dr. Chee, that fascinates me about your field is its ability really to not only reduce the cost of healthcare, but to improve tremendously the outcomes related to treatments and moving forward, and obviously improve the overall well-being of a population. How long do you think that you're going to start to make a difference within a Malaysian context itself?
Right. I think we are looking at two different segments or the objective altogether. Well, one of the objectives, yes, we very much wanted to do to introduce the concept of preventive medicine. The one that, for example, okay, if we know that certain individual is high risk, then we will make a lifestyle changes and make changes that will actually avoid or prevent the chronic diseases from developing, right? So for diabetes, cardiovascular heart disease, even to a certain extent, colorectal cancer or other cancers, these are actually all preventable disease, right?
That's interesting. I didn't know that. Colorectal cancer, preventable, that's interesting.
It is. So a lot of these are actually a lot to do with our lifestyle, basically. Now, the question then is basically, okay, I know that we are all encouraged to do, like a healthy lifestyle, obesity. These are supposed to reduce the risk of many diseases. That is very true, okay? But what if certain individuals have a genetic that are predisposed to these diseases, where good lifestyle changes or good lifestyle maintenance, fitness is not good enough, right? You often see some of the sportmen, they are very fit, but then, they get cardiac arrest, they get heart attack.
Right? And I know friends like that. So I'm very conscious of that.
Yeah, precisely. I think this is where the preventive medicine can come in, which can actually give you insight from the genetic point of view. Perhaps beside the healthy lifestyle, you might need some other area to look at. One of the simple things is that if your genetic are predisposed to certain cancer, for example, so the recommendation would be probably just to go to do the screen much more earlier in your lifetime, right? For example, colorectal cancer and prostate cancer, most of the time, the doctor will only advise you to do it when you are reaching 50 years old or 60.
Correct.
But if you have a genetic predisposition to this type of diseases, perhaps you might want to include in your annual screen to look at these cancers specifically, maybe starting from as early as 20 years old or 30 years old. We have cases in the United States, when I was working in the United States, that actually helped to save some of the individual which actually have the prostate cancer that was diagnosed as early as 30 years old, which is very unusual. But because they know that they are predisposed to this risk, so they managed to catch the cancer early and then they survive quite well. So that is the precision, well, that is the preventive medicine part of it. So which in Malaysia, I think it will take a while to actually absorb into it, because in Malaysia, we are still practicing very similar, like the old conventional, like what we call the reactive medicine, right?
Yeah, and it's a paradigm shift that is required, right, Dr. Chee? Because in Malaysia, the mindset is still an illness paradigm, not a wellness paradigm.
Yeah, precisely. But I think this is slowly shifting. If you look at the spending of the Malaysian population in wellness versus in health. So yes, the big portion of it are still in health, but you will see the trend spending in wellness is keep coming up basically. So, but the important thing is basically you need to spend in wellness that will give you value. Right. So there are a lot of wellness product out there that you can buy, but then whether it gives you the value that you needed. So it depends on individual. But I think what we want to look at is basically for preventive medicine, I think there are a lot more we can do better, right? I think for Malaysia currently, we are still very reactive. Like for example, if you go to see a doctor, and the doctor will ask you, okay, how do you feel? Are you having fever or anything? If I say I'm perfectly healthy, I don't have anything, then the doctor will be puzzled what it is, right? So I think we are still practicing the very similar type of reactive medicine, as in we don't go and see a doctor until we got a symptom.
Correct.
Right. So I think this kind of mindset, I think we need to shift it for early prevention. So now, but of course, if you are diagnosed with certain cancer, there is also where genetic and genomics can come in as well. As I mentioned earlier, like for cancer cases, it's almost always linked to, the genetic mutations of the tumors, and that could actually help you design the treatment options.
Dr. Chee, this has been a fascinating conversation. So what's next for AGTC Genomics? Okay. Where do you see yourself in the next 2 to 3 years? Are you planning to expand in the region?
Yes, I think, currently, we are still very new. So we are currently targeting some of the Malaysian markets, but obviously if given the opportunities, and also we are actually very much interested and keen to explore the Southeast Asia or the regional market, right? So I think the technology is here. So what we can do and what we can help the populations and the patients is enormous. So like, for example, one of the things that we are trying to do very much is basically, besides, supporting the research and also offering the services and so forth, we are actually developing in-house solution and also technology. We try to bring down the cost of the sequencing technology. There are many things that could that could improve on. Some of it including state-of-the-art AI algorithm to actually help us to interpret the genome much more better from what we have currently.
Dr. Chee, any final thoughts you'd like to leave us with before we end this interview?
Yeah, I think I would like to look at the genomic technology and the solution as a platform technology. I know in the conversation we discussed mainly about health. I think the technology can even go into agriculture as well, but I think that would be a topic for another discussion. But I think there's a lot that we can do with this type of technology in the healthcare settings already. And the fact that this technology is not something that, untested, it has been used in developed country, in United States, in UK. So, so I think there's a lot of work for us to do now is basically create the awareness to the patients, to the public, as well as educate the scientists and also the clinician what this technology can do and how it can actually help the patients and also the population benefits from it. That will be our main agenda for the next 1 or 2 years. Yeah.
Now, Dr. Chee, thank you very much for taking your time to be on the show. I'm Brian Fernandez, and we've been speaking to Dr. Chee-Onn Leong, the CEO of AGTC Genomics, on BizTech's Health and Wellness Show. This video and podcast will be on our social media platforms as well as our website, www.biztech.asia. Please like and subscribe to our various platforms. Thanks again for tuning in.